Hi, everyone. Thanks for joining us for this module called Incorporating Students' Lived Experiences into Teaching and Learning. We really appreciate your interest. I'm Emma Tsui, and my colleague Spring Cooper and I created this module to help instructors improve the responsiveness and student-centeredness of their pedagogy. Over the last few years, we have all lived through a public health crisis intersecting with a racial justice crisis. We've figured out how to make or procure masks and when to wear them, taking care of family members, friends, and community members, and we've decided whether, where, and how to protest racial violence. Living amid such crises may be new to some of us as a result of our privilege or good health. Or if we do have this experience, for instance, managing diabetes or grappling with mental health issues or healthcare access, we may have distanced our own experiences from our teaching. Prior to the COVID-19 pandemic, many students at CUNY entered our classrooms having directly experienced public health problems, such as living in neighborhoods affected by environmental racism, poor healthcare access, or lack of affordable housing. These experiences are often the reasons students come into public health. Now, all of these students have lived public health experience, though that takes different forms according to their positioning and privilege. And many seek to connect these experiences more actively and sensitively to the work that we do in the classroom. So in this module, we will brief faculty on a few ways to do this and provide resources for learning more. As a background, we want to share that our insights into the role of lived experience in the classroom come from an oral history project that we conducted at CUNY SPH. The goal of this project was to explore student, faculty, and staff experiences of public health teaching and learning in 2020 to 2022. We asked, what did it mean to teach and or learn public health at the intersections of the epidemics of COVID-19 and structural racism? We are drawing on, in this presentation, the 14 oral history interviews that were with CUNY SPH students. And these students covered both the MPH program and the doctoral programs. Most of the students were in community health and social sciences, though we did have representation from a few other departments. And the majority of the participants identified as being Black, Indigenous, and or people of color. And some of our participants were born outside of the United States as well.
Before we share tips, we wanted to anchor into the words of an MPH student who participated in our project and who spoke to how students feel when their lived experience is ignored or left out of the picture. This audio excerpt is 2.5 minutes long, and we will listen to it together. Before we do that, though, we want to note that this clip has the potential to be difficult to listen to. So we want to remind you to take care of yourselves in whatever ways you need. You can do this by pausing and taking some deep breaths, by taking a moment to ground in your body and notice the chair, the floor beneath you. You can notice your reactions and emotions as they arise. You can ground in the physical space by looking around the room and noticing what's around you, or you can take a break if you need to.
Like the coursework hasn't really been challenging in particular. I think that some of the information presented to us sometimes is a bit overwhelming to me as a Black person. Just like, I feel like, I don't know if you get this vibe too, but like, it's just like a lot of like statistics about like how messed up Black people are and like how we're so unhealthy and how we're this and that. And like, it's very like doom and gloom. And I don't think there's really any like support for students who are like we're actively learning this stuff, but also like experiencing this stuff. And I think that was like a hard thing for me to like come to terms with. I think one moment that really sticks out to me is like in this one class that I didn't like, but like we were talking about like, I think like COVID statistics and like how Black people are being really impacted by COVID. And we like were presenting on something, like some of our classmates were presenting. And this girl literally like broke down because she was like, my uncle just died from COVID. And I was just like, I feel like there's no support when we're talking about so many like things that impact Black people specifically that's like traumatic effect. And like, there's just like, oh, well, this is just public health and this is just objective statistics, but it's not objective statistics when it's like we're talking about our families, we're talking about our friends, our communities. And it's hard to like internalize that. Oh, it's hard not to internalize that, like while you're learning about it. Like a lot of people will talk about like Black maternal mortality without like acknowledging the fact that there's Black women in the class and like some of what they're legitimately scared to give birth because all these statistics are saying that we're going to die. Like, I think that was a huge challenge for me as a public health student. I think maybe especially as an online public health student, because there was really nowhere to go with this information or no one to tell this information till it was just kind of like, this sucks. And then that was it.
Feel free to pause the module here to take a moment to reflect on what you just heard. In this clip, we heard that students are both learning and experiencing public health issues simultaneously, that students may feel a lack of support, especially remote students. They have this sense of there's nowhere to go. What it feels like when public health education touches on lived experience without acknowledging that it is lived experience. And for our students, public health is not just public health. It's more than objective statistics. It's what they're living through every day. In order to think about how we want to incorporate lived experience into the classroom, let's take a moment to engage with a Jamboard. Use your phone to scan the QR code to take you to the anonymous Jamboard and add your ideas to the collective brainstorm to the question, where might your courses be touching on students' lived experiences? Incorporating lived experiences in the classroom requires the instructor to act as a facilitator, creating an interactive, safer space. The interactive classroom does more than allow for sharing. It also facilitates learning. The three main goals in an interactive classroom are 1, engagement. The engaged approach makes clear to all students that their participation and their authentic voices are valued. It helps to break down the barriers that may be holding students back from participation, and it helps to gain insight into why students may be disengaged. When these barriers begin to break down, students are freer to engage with the class's academic content. 2, working together. Cooperation fuels development. The ability to communicate effectively and the ability to work in collaboration with others are essential skills for success in almost any sphere of life. The interactive classroom allows the teacher to facilitate relationship building and circus group dynamics so that collaboration becomes the classroom norm. Positive student-teacher relationships. Research shows that the quality of student-teacher relationships is associated with students' academic motivation and attitudes toward school, and that students who have positive relationships with teachers are more likely to achieve personal professional success. Through warm-up questions and springboard exercises, the interactive classroom provides opportunities for teachers and students to build respect for each other's strengths and life challenges while learning together.
What we've heard from our students and learned from the literature is that we need to build classroom relationships towards trust and towards safety in order to support interactive learning. There are a huge range of ways we can do this, and we list several on this slide, and we'll review them. The first is helping students get to know one another, as Spring was just talking about, using ungraded techniques that build in choice wherever possible. Some examples of this are using icebreakers, stress-relieving activities like getting together over food or to play online games, and writing about or sharing personal experiences.
When we think about using icebreakers, we also want to think about what the purpose of the icebreaker is and how well our class already knows each other. So we might choose different icebreakers over the course of the semester to serve these different purposes. For example, choosing icebreakers may be more around getting to know each other's name at the beginning. In the next several weeks, using icebreakers that help us get to know each other more clearly. And then later on in the semester, using more fun and kind of active icebreakers to get the class built.
A second practice to build trust is that we can model and practice active listening. We'll share a resource on active listening at the end, but this essentially means really encouraging students to focus on the act of listening, putting away distraction, giving people space to speak without interruption. For instance, we might ask people to pair up and each speak for 3 minutes about a time they felt a sense of belonging in a group and a time they felt lack of belonging in a group. Then moving on to building safety, with number 3, we note that it helps to begin with agreements about how the community will communicate and support one another that are co-developed with students. These support the building of a learning community that has guidelines for how to deal with sensitive issues and inevitable conflict. A best practice for these kinds of agreements is to revisit them periodically to keep them alive in people's minds and to ensure that they're still working for the group and revise them as needed. 4, we can model and practice trauma-informed grounding, as we did early in this module before the first audio clip. This can be helpful in holding space for potentially difficult content to be encountered thoughtfully and give students a choice about how it is encountered. 5th, we can teach and practice emotional regulation in the classroom. Emotional regulation skills like creating space between a trigger and our reaction, noticing and naming what we're feeling, and just breathing can be immensely helpful for creating supportive spaces in the classroom and in work and life more broadly. These skills, like all skills, grow through learning and practice. And then finally, we suggest that you consider using a values clarification exercise, which Spring will say a bit more about.
The reason that we would want to use values clarification exercises is to get all of the different opinions about an issue circulating in the room. So sometimes students might not feel as safe if they have a divergent opinion from the norm of the class to raise it and to have some discussion about it. So we have an example values clarification exercise at the end that we'll also share with you to help you allow more space for all the voices in the classroom.
And if you feel like this list is a lot, don't worry. As Spring just mentioned, at the end of the session, we'll share resources for learning more about all of these practices. We want to give you some simple actions that you can start with for bringing lived experience into your classrooms. The first piece of advice is to recognize that your classrooms are more diverse than you think, and this may be in terms of public health experiences, political views, interests, etc. This was a major takeaway of our oral history project. And then second, we would encourage everyone to give an assignment in which students share some of their lived experiences and perspectives on the course topic as fellow knowers and teachers. And that is language from an article by Jill Wood that we link at the end of the presentation. As an example, we could ask students to think of an area of public health that you have experienced directly in your personal life. Write about this experience. What insights can you bring to public health from this experience? What should we as a field be doing differently? And we'd strongly encourage giving students an option to share these with other students in the course, but not requiring sharing, to give people the space to do that. So what might this assignment look like for your course? Here we have another Jamboard where you can share an idea for an assignment drawing on lived experience. What course might you build this assignment into, and what would this assignment be? We look forward to seeing what you write.
Now we'll listen to a couple of examples from students that participated in our oral history project about how lived experience in the classroom felt for them. Here's the first example.
I really love when people share their own personal experiences in relation to the public health issue that we're talking about. It just makes it so much more real. Of course, we can't go around asking students to share personal experiences if they're not comfortable. But it just makes things feel. It just makes us feel like we're together, like we're in this together kind of thing.
And the second one,
I think that in graduate school, we all have something important to share at this point. We all, I had classmates in that class that worked with, unhoused people, and I had classmates that worked in mental health, and I had classmates that worked with, sexual assault survivors. Like everybody had, so many people were already employed in public health that everybody had something important to share, even if they weren't the lecturer.
Incorporating lived experiences into the classroom serves to, 1, connect students to the course content more deeply, 2, connect students to each other, value students and their experiences. And valuing students really helps in a lot of ways. It helps build self-esteem and motivation, and it gives students with less domain-specific pre-existing knowledge a stronger entry point into classroom discussions. And lastly, it brings students' expertise into conversation with faculty expertise and can make classrooms more collaborative and equitable.
We've come to the end of our module. We hope it's been helpful to you. As promised, you can use the QR code on this slide to access resources to help you learn and keep working with the practices we discussed today. We'd love to know what you think. Don't hesitate to reach out.
And be on the lookout for our next module.